This video will address frequently asked questions after shoulder replacement. Is it normal to have a fever after surgery? Yes, temperatures up to and even above 101 degrees are normal in the first few days after surgery. If they persist beyond several days, please contact our office. Is it normal to have nausea after surgery? Yes, nausea is a common side effect of anesthesia and surgery. It may also be a side effect of postoperative medications. We will give you a prescription for Zofran, which is an anti-nausea medication. If you have a history of significant nausea problems around the time of surgery, let your care team know, and we can prescribe a scopolamine patch, which is put on prior to surgery. Is it normal to have constipation after surgery? Yes, constipation is common with pain medications. We recommend starting a bowel regimen with Colace and Miralax even the day before surgery and continuing for the week after surgery until bowel habits return to normal. Additional laxatives may be needed, such as milk of magnesia or suppositories. Is it normal to have dizziness or lightheadedness? This is common due to anesthesia, fluid loss, and pain medications. Make sure to stay well hydrated with electrolyte fluids such as Gatorade, Powerade, or Pedialyte, and be careful arising suddenly. Change position slowly. Sit before you stand. How long should I keep a dressing on my shoulder? The dressing we put on during surgery can stay on until we remove it in the office at your first postoperative visit. When can I shower? You can shower 48 hours after surgery. When can I submerge my shoulder underwater? We generally advise patients to wait at least 3 weeks for this, provided the wound is completely dry with no drainage. What if I have wound drainage? Is this a problem? There may be some bleeding through the dressing for the first 24 hours. This can be reinforced with a new dressing if the postoperative one is saturated. Persistent drainage can be a concern for infection and should be addressed. Notify your surgeon if you have persistent wound drainage. Is it normal to feel depressed or tired after surgery? Yes, the stress of surgery and recovery, as well as the energy devoted to healing, can lead to fatigue and depression for a few weeks after surgery. Sleep disturbance is also common. These are normal occurrences that typically get better after 4 to 6 weeks. Do I need to get a recliner chair? While it is not necessary to sleep in a reclined position after shoulder surgery, many patients find it to be more comfortable to do so for the first few weeks. If you do not have a recliner type chair, you may consider buying or renting one or a similar device that allows you to sleep in a reclined position in bed. My arm and hand are swollen. Is this normal? Swelling in the surgical arm is common. The best treatment is elevation, which can be done by lying flat and putting the arm on several pillows so it's elevated above your heart. I have bruising around my chest, flank, and arm. Bruising in any one or all of these areas is common and nothing to worry about. It will resolve with time and does not require any specific treatment. Will I set off the metal detector at the airport? Most security systems at airports are surface scanners and not metal detectors. Your shoulder will not set off a surface scanner, but it will set off a metal detector. If you alert security of your replacement, they will generally just do a light pat down. Are there any forbidden activities after shoulder replacement? Once fully healed, shoulder replacements are very durable and permit most activities. Repetitive high-impact activities may risk earlier wear and are generally discouraged. That said, sports like tennis, golf, and pickleball are considered to be fine. How long do I have to wear a sling? We recommend wearing a sling for about 3 weeks except during exercises, and to wear it at night for about a month to protect the arm from getting into unfavorable positions during sleep. You may remove the sling if you are sitting and put the arm in a position of comfort. How long does recovery take? Recovery time may be different for everyone depending on the severity of the arthritis, preoperative range of motion, and many other factors such as genetic healing response. In general, it takes 24 months to reach maximum recovery, but patients may achieve 75% of this in the first 4 to 6 months after surgery. When can I drive? We generally recommend not driving for about a week. Do not use the operated arm to shut the car door or steer the car. When can I fly? You can safely fly at any time after shoulder replacement, provided you do not have to use the operated arm for lifting or handling luggage. When can I return to work? Return to work depends on what you do. If your job is sedentary, you may return as tolerated. If it requires more strenuous use of the arm, you will not be able to do this with the operated arm for at least 3 months. If your work provides restrictions on limited use of the operated arm, this may be an option. Talk to your team about this. Thank you for entrusting your care to our practice. We are committed to ensure the best possible outcome for our patients. Our AVATAR program has been refined over years of experience with 3 main goals: less pain, better function, and faster recovery. For any specific questions, please reach out to us at avatar@kneehipshow.com.